This is Dr. Rich Schuttler with my program, Understanding Qualitative Research. This lesson is titled, What is Qualitative Research? In this lesson, I will address exactly what is qualitative research. I'll also address what qualitative research is not. I'll provide a suggested reading, as I'll do in all lessons. I like to provide suggested readings because sometimes students and other people who listen to my programs may want additional information. And my programs, they're not completely exhaustive like I would if I wrote a book, but I give you books that are good, ones that I've kind of vetted out and believe that will serve you well. And they're also books that you can cite in your doctoral dissertation if you're working on one of those. And I'll go through a reflective summary. All my lessons have a reflective summary. I do this purposefully because all the research that I have read and all my lived experiences suggest that when you have reflective summaries from different lessons that you go through, you tend to remember the information more. So that's my goal, is that once I provide the information in each lesson, that maybe by me giving you what I believe are the highlights of the lesson will help you in remembering more information from each lesson and from the entire program. I encourage you, if you don't have a note paper with you and pen, you might want to stop the program for a moment, just put it on pause, get a pen and paper, and take some notes. Qualitative research is primary exploratory research. And exploratory research, to me, suggests that it's about trying to find out something you don't already know. That may make sense because research is trying to find out information you don't know. But exploratory research tells us that we're going to look out at what is perhaps not even considered yet. Exploratory research could mean, let's do research on going to Mars. Nobody's been to Mars yet, but people have been to the moon. We have scientists who have sent probes there, have got information back, all sorts of data. We can look at the people who have been studying Mars and do an exploratory research study on what life would be like in Mars. We certainly see it in movies, so somebody must have done some sort of research on Mars already somewhere, somehow. And qualitative research is used to gain understanding of underlying reasons, perceptions, and motivations of those who you interview. If you're going to interview 20 people about what happened in an emergency room at 3 in the morning when 5 ambulances pulled up and there were 6 people who were in need of emergency medicine, well, we would be looking at the underlying perceptions of what happened. We would ask people, what do they believe to be true? What are the reasons why they did certain things? What were their motivations behind serving each patient, other than just making them healthy? Maybe it was they had some motivations behind doing it because they were specialists and they wanted to show their skills. They wanted to be able to save the patients. They needed to be able to take care of the patients' families at the same time. So qualitative research is quite broad in many different ways, and I'll address more ways as I go through. Qualitative research provides insights into a problem or helps to develop ideas for hypotheses that can be applied for doing quantitative research later. It's not uncommon that one might do qualitative research, gain common understandings from people about a certain situation, and then use those common understandings, maybe they're produced in themes or topics, and then use and quantitative research to create a Likert type survey, and then identify to what extent do the different factors that came out of qualitative research apply. So qualitative research is not necessarily just in of itself qualitative research. It can be, but it can also be used as a stepping stone. In many doctoral dissertations and in many corporate research organizations, they do both qualitative and quantitative. We'll call that a mixed method, and often they'll do one before the other. You can do them both simultaneously. It just depends on what kind of information you're hoping to gather from the data that's going to provide what you need to perhaps solve the problem or give information about the problem. So what is actually qualitative research? Continuing on, I think it's more difficult than most realize. I, for 20 years, have been teaching qualitative and quantitative research and doing different programs for different universities, and I always hear students talking about oh, I'm going to do qualitative research because it's so much easier than quantitative research. That's not necessarily true. It certainly is not faster than quantitative research. So as you learn more about this program, I think you'll come to an appreciation that qualitative research is more difficult than perhaps even you realize it to be. Qualitative research is much like I mentioned a few minutes ago with exploring the unknown. We want to do research to find out what happened in a situation, or perhaps in a phenomena, how people manage through it. In the world right now, as I'm recording this, we're just coming out of the shutdown dealing with COVID-19 virus, where many people in many countries died and people stopped working. They shut the economies down to help reduce the spread of the COVID-19 because there's no cure for it at the moment. Well, we're living in a phenomenon. Certainly it is the situation, but more so, I would do research to find out how people live through the phenomena. I would look at the research to find out how people responded to the phenomena itself. I would be identifying these lived experiences in qualitative research. Now, lived experiences could be nothing more than asking people, how did an accident happen that 3 or 4 people happened to see occur on the intersection that they were near? You ever see a car accident? You weren't in it, but you observed it. And you ever notice that if 4 or 5 people are asked what happened, you get different answers. And because some people may have seen it differently, some people may not have seen it all and may only heard it, and some people may have seen something, but their unconscious mind tells them they've seen something else because that's just the way it is. So our lived experiences may not always be true, but we have some sort of experience in the scenario. If I wanted to gain a common understanding of the nurses in that emergency room that I mentioned earlier, when all those ambulances pulled up at night, they have lived experiences. Even if it's a situation or a phenomena, it depends on how we define the scope of the research, but everybody you're going to talk to will have some sort of lived experiences about what you want to learn about, because if not, then you're interviewing the wrong people. And we're going to report what happened. When we look at doing a case study, oftentimes in a multiple case study, we would get multiple points of view about the same situation. Going back to that emergency room example that I gave, I might interview 4 or 5 nurses and 4 or 5 doctors and 4 or 5 anesthesiologists and the 4 ambulance drivers that got there first. I may interview some of the staff members that were there on duty that night. I might also interview the staff, the senior staff, like the C-suite, like the president and the vice president and the director of operations and the director of nursing, to find out what policies they were supposed to follow when that emergency happened. So as you can see, if I interviewed all those different groups of people, really only interviewing 4 or 5 of them from each different group, I would get multiple perspectives about what happened. I could then find out what's common amongst the nurses, what's common amongst the doctors and the other stakeholders, and then I can combine them together and find out what's common amongst all of them. So as you can see, just in that example, this might be more difficult than most realize. It's certainly exploring the unknown, because in the middle of the night, the only people who knew what happened were those who were there, and they may not even be able to recall it so well because it happened so quickly. We identified the lived experience of those involved, and we are able to report what happened. And we get focused on meaning. And again, it could be real or it could be perceived. I'll go into this more throughout the lesson, and that's what we have to understand about qualitative research, is that it may be perceived, because a lot of times we look, particularly when we're doing phenomenology, we're asking for people's assumptions, beliefs, and what they have in regards to perceptions. And they may not always be true. For example, if we are dealing with faith or religion or politics and we're asking people certain questions, they may tell you what they believe to be true, and it may be actually wrong. It may be incorrect, but that's okay. That's the value of some research designs, is we're looking for those lived experiences from their assumptions or what they believe about something. Because remember, whatever we believe may not always be true. We like to believe that all of our children are great children and they're well behaved, but sometimes when the principal calls us and tells us that's not the case, we have a perception different than the experiences of the principal, right? So these are informative but yet important ideas to keep in mind when you're learning about qualitative research, that we're going to generate meaning, and that meaning will be subjective because everybody who you talk to in interviews will have their own subjective thoughts about what occurred to them. And thus, it's subjective in many ways. When I do research, particularly qualitative research, it's me who is creating the interview questions. So they're subjective based on what I know about the literature, what I know about the problem, what I know about the situation. And then I ask people what their experiences were, and their experiences will be subjective to what they believe to be true. And then when I analyze the data, all those comments that I received from everybody I interviewed, I have to come up with some findings, those common understandings. That's going to be subjective in how I do my data analysis. So you can see that qualitative research is going to be subjective, and that's okay. It's not a bad thing. It's not about good or bad. It's about what it is. And we look at that, and we will look at reducing any potential bias, and we'll look at limitations and delimitations of qualitative research and certain assumptions that go with qualitative research to help ensure that we provide the best possible information from the data we collect through those interviews. Qualitative research is based on recall. We don't do qualitative research in the actual heat of the moment. We're not going to do, qualitative research in that emergency room, because we're not going to sit around every day waiting for an emergency situation to happen when 3 or 4 or 5 ambulances pull into the parking lot. So we're going to do all this qualitative research based on what people believe to be true. We can't actually do research on the corner when an accident happens, because we don't know if one's ever going to happen. People aren't just going to stand around the corner and say, well, there's a lot of accidents around here, I'm going to wait for one to happen, right? That doesn't work that way. So everything's based on recall. And when we talk about recall, it's what we can remember as well. People's memories isn't as good as what you think they might be, even if the scenario only happened 2 or 3 days ago. Qualitative research is about understanding related factors as well. If I'm going to do research at that hospital, I need to know something about the related factors. For example, what are some of the policies that are in place? What's the training for the nurses and the doctors and the anesthesiologists and the staff members that are there at 3 in the morning? I have to understand what the staffing requirements are. Are they staffed to handle that kind of load all at once? Or in the middle of the night, is there manning at minimal levels, and then they have to call people in if there's a big emergency? So there's many different factors related, and if I'm going to use some sort of framework, whether it be a theoretical or conceptual framework that I'm going to use, for example, even with that emergency room, if I wanted to look at different types of scenarios that could be based on a leadership style or a management philosophy, first in, first out, whichever person gets in there first gets service first, or is the information really whichever patient needs the attention first, the most gets in first, and so somebody may have come in first, but whoever came in second or third will get the priority and get worked on first. These are kind of the ideas when I talk about related factors. Again, qualitative research is not as simple as many people make it out to be. And in qualitative research, this is what we tend to do. We tend to explore something. We tend to describe or explain. Now, exploratory, descriptive, and explanatory are 3 different types of case studies. I'll go through each one of those. I have a lesson for each of those. And it's important to understand why we have so many different types of case studies. There's probably about 7 different types of case studies. I'm going to describe about 5 of them for you in this program because they're the most common. But we are going to do different types of research based on what we want to know. If we want people to describe something like a step-by-step process that they were involved with, we might ask them via a descriptive case study. If we want people to explain something like how they achieve something, we would do an explanatory case study. But if people who we're talking to have no experience at all to be able to describe and explain, that's where we might do an exploratory case study. For example, going back to the idea of exploring people who have maybe some knowledge, but have never been to Mars before. So we can do an exploratory study, but we really can't do a descriptive or explanatory because people can't describe what the moon's really like. They can't explain it. They can only tell us what they believe to be true. And assumptions, beliefs, and perceptions tend to go with phenomenology. In phenomenology, we're looking to identify and report lived experiences. And lived experiences in phenomenology are caveated, if you will, by people's assumptions, their beliefs, and perceptions. I have an entire lesson on phenomenology, so I won't spend a lot of time here, but I wanted to at least show these words because these are associated with qualitative research, and each word has its own specific meaning. Phenomenal or situation-based. Most qualitative research is based in a phenomena, for example, COVID-19, or it could be a situation like an accident that happened, or perhaps something that happened in that emergency room. A situation tends to be more so something that has a stop and ending point, where a phenomena could be ongoing. For example, COVID-19 is ongoing. It didn't just start and finish. For example, I worked with a student, and she did a phenomenological study where she identified and reported the lived experiences of African American women who suffered from depression, who are members of Pentecostal churches in North Carolina. So the phenomena is ongoing. It didn't just start and stop. It may have started and stopped for some people, but in many instances, people who suffer from depression, they have to manage that through their whole life. And you could see how narrow the focus was. African American women who suffered from depression, were members of Pentecostal churches in North Carolina. So you can see, and you know exactly from what I told you, who would be the people that she would interview. It'd be those women who met that criteria. So as we get into the concepts of qualitative research more deeper as the lessons go by in this program, I want you to try to understand and keep in mind terminology. Research has its own terminology, and if you're going to be writing about a case study and you start to use phenomenology words or vice versa, it's not going to go too well for you and people are going to be confused. And that's why I create programs like this, to help explain to people the working knowledge and information and actual steps one can follow to complete qualitative research. This program is designed not only for students, but for faculty. I have worked with a lot of faculty in my 20 plus years working with doctorate students who do not understand qualitative research well, yet they are mentors and dissertation chairs. It's usually because they team up with somebody to help them through, or they just give bad advice to students and the students suffer. Qualitative research is about rebuilding what was. It's about recreating the concepts, the idea. You've probably seen this in movies before where somebody else sees something happen, like detective movies and mystery novels. They'll show you basically what happened, and then they'll show you how it happened. They'll build the whole story around. That's really what qualitative research is about. It's about rebuilding of what was so people can understand and learn. In the military, particularly in the Army, they have a program. It's called After Action Reviews. And after action review means, in the military context, is that once an activity is over with, once some sort of exercise or campaign, they call them sometimes when they go and fight a war, is over, they'll do a review after action. It's after it occurred. Then they'll do a lot of research and find out exactly what happened so they can learn from it. So if there's any mistakes that were made, that they can correct them, apply reflective learning forward so they get better and better at what they do. If you want to find information on that, many organizations use it, and a lot of people even don't know about the process, how formalized it can be. I encourage you to look up After Action Reviews, AAR, in something like Google or Wikipedia, and you'll find all sorts of information in there. Contextual based. Well, contextual in this context means that what you're going to produce is information. It's not going to be about so much numbers, to what extent was something related or correlated to something. It's going to be more so this narrative. When you look at creating information from qualitative research, you're going to take large amounts of conversational information from what people provide you in their answers to interview questions, And you're going to have to find out what's common, what's themes, if you will, or nodes that are common amongst all the people to be able to produce something of value, which is a narrative outcome. So if I wanted to find out what was common amongst all the workers at that hospital involved in the emergency situation, I would probably find 4 or 5 different things that they all agreed to that happened. Like either they were prepared, they were not prepared, something happened that they didn't anticipate through their training. Everything's contextual based, so we would be providing information in probably paragraph form in the findings. Qualitative research is deliberately planned and executed. If I was going to do that research in that hospital from that situation that happened in the middle of the night, I would deliberately plan what kind of questions I needed to ask, because I would first find out what were the problems, were there process concerns, were there people perhaps who didn't do what they should have done. I would do a lot of planning, and then I would do a certain amount of execution in that I would create interview questions and have it in a setting that is conducive for these people who were involved in it to give me information that I need in response to my interview questions. So a lot of times I've heard students say, oh, qualitative research is easy. All I have to do is go out there, write a couple questions, go interview a few people and find out what they all believe. Well, that's not necessarily true. And we're going to talk more about that, or at least I'm going to talk more about that, and hopefully we all will learn together. And when I say we learn together, because there's opportunities through the program where if you want to contact me, you'll be able to do that, and I'll show you how at the end of every lesson. So what qualitative research is not? Well, it's pretty much the opposite of everything I just told you, right? Well, yes and no. So I'll go into a little bit about what qualitative research is not, just to help reduce any confusion that you might have. Again, if it's more complex, that means it's not as simple as it seems. The concept of keep it simple student is not something that's going to be really popular thing with qualitative research, because while we want to keep the information and how we do qualitative research at the simplest level, it's not as simple as it seems to actually interview people, because you have to create interview questions that align with the needs of the study. And it's not as simple as it seems, because I've seen a lot of students who have done their interviews and they interviewed 15 people with 8 different interview questions, and the findings were worthless. And they were worthless because the student got involved with conversations during the interview. They didn't just ask the questions and be quiet and let the people answer the questions, maybe ask a follow-up question or two if need be. But if you're going to get involved in a conversation, then it's no longer an interview. And these are some of the things that you'll learn in my program that'll help you understand better how to do research. And if you're a faculty member, how to assess research and help students do better. And if you're in a corporate setting, it'll help you to produce better research for your company or your clients, like I do as a business consultant. It's not measured, it's not calculated. We're not going to look and create a number, to what extent do people believe in whatever. We're not going to look at measuring any variables. We're not going to test any hypotheses. We are going to have hypotheses in qualitative research. The difference is we don't test them. Consider a hypothesis nothing more than an educated guess. Now, I always ask students, what do you anticipate the data to be when you collect the data before they start collecting that data? Because they should have somewhat of an idea what they're going to get, because after all, they have a certain amount of expertise in what they're going to study. They're creating the program that they're going to study, and so they should have some information, this educated guess. The value comes in is when the student finds out, yes, that's true or not so true, or they find something they didn't expect. I'll always ask a student at the end of their research, what did you find that you didn't anticipate or expect in the results? There's usually something, and oftentimes it's that one thing that they didn't expect that makes the study worthwhile. It's not always accurate. Qualitative research is not always accurate because we're asking people to recall, right? We're asking people to give us their assumptions. We're asking them to give us their beliefs. But that's okay. It doesn't have to be accurate. We want to find out what's common. Usually when we find out what's common, then we can usually assess, okay, this is what's common, and is it correct or not, or as it should be. For For example, if I asked 15 people how they did a certain process, I could find out how much variation was in that process from all the different people I talked to. I can really kind of look at saying, were they somewhat accurate, but not completely accurate in how they followed it. So qualitative research is not always accurate. I want to talk about feelings related. Unless you're a psychologist, do not look to address feelings in questions or your qualitative research. If you're a trained psychologist, certified psychologist, or if you're a student in a psychology program, that's different. But if you're not in a psychology program, if you're not a psychologist, you should not be trying to gain what people felt about something, because we're not trained to understand how to assess feelings. In many of the universities I've worked at, I've seen students put in feelings when they're asking questions, and at the end, the results are just not as good, or in some cases, they don't even let them publish such findings. As faculty members, some are not aware of this, and that's okay. Hopefully they will learn. But for students, if you're listening to this program, just know that don't look into checking for feelings about what people feel. What were their feelings about what they did? Because that's not what we want to study. And more than likely, you're not going to be able to do that kind of research anyway. So just stay away from the feelings and you'll be fine. Because qualitative research is not always accurate, it's not exact. But we can get it to be as good as we can by finding out what's common. Just try to think of it that way. We're not trying to put a number to it. We're not trying to say whether it was good or bad. We're not trying to be accurate. We're not trying to be exact. We want to find out what's common. Common. If we find out what's common with the majority of the people, like when we seek data saturation, I have an entire lesson on data saturation, that tells us that we're not generating any new information by interviewing more people. Doesn't make it exact. It just means that I talked to enough people and I'm getting the same findings over and over. I got a complete lesson on data saturation where you can learn about that and actually how to test it and how to do it correctly. Qualitative research is not exhaustive. I mean, how can it be? You're going to interview, maybe 20 people, maybe even less. In some research, maybe 40 people. It depends on what the scope of your work is. But let's face it, we're not going to interview everybody in the hospital about what happened in the emergency room because, one, everybody wasn't there, and I don't need to talk with every nurse. I don't need to talk with everybody who was there, every patient. I don't need to talk with every doctor. I don't need to talk with every family member sitting in the lobby to figure out what they were going through. So it's not exhaustive, and it's not meant to be. So again, it's not about good or bad. What qualitative research does not make it bad. Just makes it what it's not. And it's not generalizable to all. For example, if I did that research in the emergency room in the hospital that I've been alluding to, what I find will probably not be generalizable to every other hospital in every other city and every other state in the country, because you have different people, different training, different policies, different rules that they follow, different processes that they've gone through. So it may only be generalizable to that group. Now, maybe, depending on what kind of research you do, it may be generalizable to others. But in the case of the lady that I mentioned, where she was doing that phenomenological study with women who suffered from depression, who are members of Pentecostal churches in North Carolina, if she was to include people from other churches, it may be more generalizable. But if it's only Pentecostal churches in North Carolina, well, it may not hold true that the same information you can generalize to the Catholic churches in South Carolina, because it's different people, different experiences, different backgrounds. The recommended reading that I have for this lesson is a book titled Methods of Educational and Social Science Research. The book that I have here for you to see and that I recommend is based on my reading of the book, its value to qualitative research. You're not going to find everything in here about every little research design in here, or every detail, but what you're going to walk away with is understanding better about what qualitative research is. Keep in mind, qualitative research is a method. And you have different designs such as case studies, you have phenomenology. These other designs of qualitative research, there's different authors who are experts on each of those. And I'll tell you right now, I'll have books recommended for you in each of those lessons, but always find the experts who wrote about what you're reading. Don't confuse when somebody says, go ahead and cite, the research method and design, you cite one general person, then that wouldn't work. Like, for example, in the case studies, if you're writing about a case study, the design and the value of it and what the purpose of case studies are, you would not use this book for that. But if you have to justify what qualitative research is and when do researchers use qualitative research, this is the book for you. This is also a source that you can cite in a doctoral dissertation. So whether you're a student or a faculty member, you need to know early on that there are certain books you cannot cite. For example, we don't like to have students citing popular books, these how-to dissertation books. We don't like students citing textbooks, because textbooks and popular books are designed for authors to make money. There's nothing wrong with that. I've got a few of those books myself, and you're welcome to buy them. But you wouldn't cite a book like, for example, Cresswell, his book, because he wrote, 6, 8 different books about everything about research, qualitative, quantitative, mixed methods, you name it, he wrote about it. But he writes textbooks for classroom use. It's great to learn from textbooks. It's great to learn from popular books if they resonate with you, but we don't cite them in doctoral level dissertation work. The majority of people who are listening to this program are going to be doctoral students or doctoral faculty. Now, others may listen to it because they're involved with corporate research or they're in executive MBA programs and they want to learn more about research. This program will certainly do it for you, but the majority of the focus is going to be used with examples for a dissertation research. So, reflective summary, I've spent a little time telling you what qualitative research is, on the value of it, the scope of it, and the true aspect of what kind of information it's going to create for you. I hope to offer a little information about what it's not, how it's not exact, and how it's not going to be generalizable to other groups outside of those people that you have in your research. It's important to understand what qualitative research is and what it's not, because there tends to be a lot of confusion. I'm a big believer that if you're going to do research, whether you do it in an academic setting or professional setting, like corporate research, or you just do it for your own purposes for whatever you might do. I do research for my books, and I do a lot of different research projects that I just find of interest that I want to generate knowledge about for other people who are suffering some sort of problem or could use information that I can provide for them. But research, qualitative research, is the true understanding of what people have experienced or what they've gone through, what they recall. And that's really the value of research. And to understand what it's not sometimes is more important than understanding what it is. The recommended reading I gave you was about a generalist for what qualitative research is about. I believe that education is a lot like life. The more you put into it, the more you're going to get out of it. When you're doing research, the time that you spend planning to do that execution of the research itself is time well spent. The value you can produce from research is, in many cases, life-saving, organizational saving, career saving, and it could also help enrich you in your career as well. Thank you very much for listening to this lesson.